name is Brian Klassen, and I'm the Director of Strategic Partnerships for the Road Home program. It's a fancy title. It's more of a back office kind of role, but I'm basically the main point person for a lot of the major donors, organizations that support our work, either financially or through other kinds of collaborations. This is a relatively new role for me. I come to this role as a trained psychologist. I was a clinical psychologist for many, many years. I still practice a little bit. And so I like to think that I bring some of that frontline, sort of in the trenches experience, so to speak, to my role in creating partnerships that support the work of Road Home. What I like most about this job is getting to support the work of such a dedicated and talented clinical admin research team that Road Home has. I think the successes, the lives changed that I hear about all the time, I sort of get to live vicariously through that, knowing that the projects that I'm working on behind the scenes ultimately lead to that kind of outcome. The Road Home program is a philanthropically funded program of Rush University Medical Center in Chicago. And it was founded in March 2014, really out of a growing sense and urgency that helping returning service members from Iraq and Afghanistan wasn't really the job of one government agency or health system or nonprofit. It really required a national collaboration and the grateful efforts of many supporters, donors, healthcare providers. And so the Road Home program is Rush's answer to that. If a veteran or service member or a family member were to ask me why they would consider Road Home, there's a lot of things I could say. You know, we have a talented clinical team, we have amazing outcomes, cutting edge clinical techniques. But I think the one thing I really want to say is this program might save your life. This is not a hunch I have. This is literally what we've heard from hundreds of other people like you. Since inception, our mission has been to compassionately serve service members, veterans, and their families through individualized behavioral health care and navigation of services. I think how we have gone about that mission has changed for the better over the years. Specifically, I would say the menu of services we provide has expanded significantly. Simply put, I think we're providing more services to more people in more places than ever before.